I get this question a lot. How do you set your prices? How do you set your private practice fees? And this is kind of a hard thing. I struggled with this a lot. And I think this is obscure for a number of reasons, including that the people who usually set the fees, the insurance companies, don't want you to know what they're charging the patient and how little they're paying you. So, when I started, I kind of did some market research. I asked around and figured out how much, my orthobiologic kit costs. And I said, okay, that's twice the amount. I'm going to just do that. So that's not the way we do that. That is crazy talk. Please don't go ask your friends, check the doctor down the street at what they're charging and undercut them. That is a horrible idea. So what we actually need to do is figure out what you're worth, what you bring from a value standpoint to your patients, and then how to talk to patients about value and about money and figure out how to charge, because money's just money unless you assign a value to it. So when you're deciding how much to charge, you have to figure out what value you're bringing and then talk to your patients about how valuable your treatment is and what it allows them to do. Does it allow them to play tennis again? What would be the price that they would put on that? And think, how many new rackets, how many new, tennis memberships would they pay for if they could play tennis again? And then you assign that value to the treatment that you're giving them. So there are some kind of hard and fast rules. Make sure that you calculate all of the costs involved, including your overhead, all of your kit fees, all of your time. I think as physicians, we undervalue our time because other people, our administrators, our insurance companies, undervalue our time. Please don't undervalue yourself. Your time is valuable. You are an expert. And so you have to take that into account. And so I'm just going to give you a quick maybe framework on how you set your fees. So you have to take all of these into account. Really, any orthobiologic treatment is, I think, the starting basement prices. I think you need to start at $1,500. There's been a lot of research that's been done on this, and that is the market, quote, bottom market value. And then if you bring extra value because you've done extra training, you give extra care, extra time, then you need to go up on that. If there is something that you do that nobody else does, and you can take care of patients in a significantly better way, then make sure you factor that in to the cost of what fees you give. And so really, it's all about value. And so in your private practice fees need to include those costs associated with the value that you bring to the patient. And so I also get these questions all the time about, well, how, now that you've set your fees, how do you actually talk to patients about money? And we don't get any training in this. And so when you start talking money, it gets very anxiety producing. And sometimes when I'm coaching my physicians that I help learn how to do this, I actually make them say this over and over and over so that it comes out of your mouth without anxiety. And so if you're telling your patient, well, it's going to be about sort of in a roundabout way 1,500, and you end with a question, they're not going to be very confident that that's the right price, and they're not going to feel like you're providing value. But if you talk to them and you say, hey, listen, the price of the procedure is $1,500, and that's going to help you get back to playing tennis in 6 weeks. I'm really excited to bring this treatment for you, and when would you like to schedule? That is a very different experience for the patient, and you don't have to justify why the price is the price. Just like the store that you buy bread at doesn't justify the price of bread, you don't have to tell them why you think that's a good price. That's the price. And you just are providing value. You're showing them what the value of that is. And a strange thing happens where the higher the price, people think it is better or more valuable because the price is higher. It's strange psychology, but just think about when you buy an expensive car or even an expensive piece of clothing, you expect that the quality and the value is going to be better than if you buy the $5.99 t-shirt. You know that the $5.99 t-shirt is not going to be of the same quality as the $30 t-shirt. It's just not. And we all know that. So we don't want to be the low-cost leader because people assume that the quality and the value is less. We want to make sure that they know that the treatment that they are getting is valuable by assigning an appropriate price. So the other thing that you can do if patients are really struggling, you can talk to them, be like, hey, we understand that this may not be something that you can do tomorrow, but maybe not. Maybe it is. Maybe they have $1,500 in their wallet and they're happy to plunk it down right now today. But please don't assume that you know what's in their wallet. Please don't assume that you know what's in their bank account. And the only way that you know what they value is by asking them what's valuable. And they're going to vote with their dollars what's valuable. And they're going to tell you with their scheduling what's valuable. So if you want to learn more about how to set prices and how to talk to patients about money and about cash, please click the link below to sign up for my newsletter. That's going to help you kind of guide you through and coach you through all of these finer sticking points of how to take really good care of your patients. And then there's always an opportunity if you need some one-on-one guidance. I'm also available to do that as well. So click the link below and we'll see you soon.